between real and unreal experiences, to think logically, to have normal emotional responses, and to behave normally in social situations. Symptoms. Schizophrenia may have a variety of symptoms. Usually the illness develops slowly over months or even years. At first the symptoms may not be noticeable. For example, you may feel tense or have trouble sleeping or concentrating. You can become isolated and withdrawn and have trouble making or keeping friends. As the illness continues, psychotic symptoms develop. An appearance or mood that shows no emotion, bizarre motor behavior in which there is less reaction to the environment, false beliefs or thoughts that have nothing to do with reality, hearing, seeing, or feeling things that are not there. Thoughts jump between unrelated topics. Symptoms can be different depending on the type of schizophrenia. A catatonic type has agitation, decreased sensitivity to pain, inability to take care of personal needs, negative feelings, motor disturbances, rigid muscles, and stupor. A paranoid type has anger, anxiety, argumentativeness, delusions of persecution or grandeur. A disorganized type has childlike or regressive behavior, delusions, flat affect, hallucinations, inappropriate laughter, and not understandable or incoherence. Repetitive behaviors and social withdrawal.
During an episode of schizophrenia, you may need to stay in the hospital for safety reasons and to provide for basic needs such as food, rest, and hygiene. Antipsychotic or neuroleptic medications can change the balance of chemicals in the brain and can help control the symptoms of the illness. These medications are effective, but they can have side effects. However, many of these side effects can be addressed and should not prevent people from seeking treatment for the serious condition. Some common side effects of the antipsychotics may include sleepiness and weight gain. And other side effects may be feeling restlessness or the jitters, problems of movement, and muscle contractions. Known as atypical antipsychotics appear to have fewer side effects. They also appear to help people who have not improved with other medications. Treatment with medications is usually needed to prevent symptoms from coming back. Supportive and problem-focused forms of therapy may be helpful for many people. Behavioral techniques such as social skills training can be used during therapy or at home to improve function socially and at work. Family treatments that combine supportive and education about schizophrenia appear to help families cope and reduce the odds of symptoms returning. Programs that emphasize outreach and community support services can help people who lack family and social support.
Causes. Schizophrenia is a complex illness. Even experts in the field are not sure what causes it. Some doctors think that the brain may not be able to process information correctly. Genetic factors appear to play a role. People who have family members with schizophrenia may be more likely to get the disease themselves. Some researchers believe that events in a person's environment may trigger schizophrenia. For example, problems such as an infection during development in the mother's womb and at birth may increase the risk for developing schizophrenia later in life. Psychological and social factors may also affect its development. However, the level of social and family support appears to affect the course of illness and may protect against the condition returning. There are 5 types of schizophrenia: catatonic, disorganized, paranoid, residual, and undifferentiated. Schizophrenia usually begins before the age of 45. Symptoms last for 6 months or more, and people start to lose their ability to socialize and work. Schizophrenia is thought to affect about 1% of people worldwide. Schizophrenia appears to occur in equal rates among men and women, but in women it begins later. For this reason, males tend to account for more than half of patients and services with high numbers of young adults. Although schizophrenia usually begins in young adulthood, there are cases in which the disorder begins later or over 45 years. Childhood onset schizophrenia begins after the age of 5, and in most cases after normal development. Childhood schizophrenia is rare and can be difficult to tell apart from other developmental disorders of childhood, such as autism. And diagnosis. Because other diseases can cause symptoms of psychosis, psychiatrists should make the final diagnosis. The diagnosis is made based on a thorough interview of the person and family members. No medical tests for schizophrenia exist. The following factors may suggest a schizophrenia diagnosis, but do not confirm it: course of illness and how long symptoms have lasted, changes from level of function before illness, developmental background, genetic and family history, and response to medication. CT scans of the head and other imaging techniques may find some changes that occur with schizophrenia and may rule out other disorders. Prevention. The best way to prevent symptoms from coming back is to take the medication your doctor prescribed. Because side effects are one of the most important reasons why people with schizophrenia stop taking their medication, it is very important to find the medication that controls your symptoms without causing side effects. Always talk to your doctor if you are thinking about changing or stopping your medications. Some complications that people have are: people with schizophrenia have a high risk of developing a substance abuse problem. Use of alcohol or other drugs increases the risk of relapse. Physical illness is common among people with schizophrenia due to side effects from medication and living conditions. These may not be detected because of poor access to medical care and difficulties talking to healthcare providers. Not taking medication will often cause symptoms to return. When to contact a doctor, call your healthcare provider if voices are telling you to hurt yourself, you are feeling hopeless and overwhelmed, you are seeing things that aren't really there, you feel like you cannot leave the house, and you are unable to care for yourself.
Here we have Sarah, and her aunt is schizophrenic, and we're going to ask her a few questions today. So, what do you see different in her personality or actions?
Like, you can just notice it when when you're around her, she'll just say something and you can just tell she's paranoid. I don't know,
Do you find it harder to have a close relationship with her?
No, not really. Well, kind of, because she just things she says, and she calls she calls our house, my aunt, uncle, our whole family every single day, probably 2 times a day at least. And it gets to be a bit annoying, but for the most part she's the same, but not really.
Do you see it affect your family?
Yeah, definitely. It takes a toll on family. We've just started to, you just kind of have to laugh her off a little, I don't know, you can't take her too seriously. You just kind of have to joke around with her.
Mm-hmm. So, what sort of behaviors does she exhibit?
Well, she's a paranoid schizophrenic, and she'll here for instance, she'll be oh my god, someone took my paints from my apartment, I swear it's the janitor, or something like that. Or one time she called us and was I feel these pricks at the bottom of my feet, and she thought that someone was coming into her apartment at night and pricking her feet, and just kind of things like that. I don't know.
Do you know how they diagnose it
For
for her?
Well, my grandparents, her parents took her to Brown County, the mental hospital, and they got her, they diagnosed her there when she was 20.
She was 20. How old is she now?
She's 55.
Okay. Does she live independently, or does she need continued support?
Well, she lives in her own apartment downtown with it's a special living facility for, it's low income housing, and it's also for mentally ill people.
So, does she maintain a career or job?
She's since the government gives her money and stuff, for that she's not allowed to have a job.
Is she able to maintain a social life or a stable relationship?
I don't know about a stable relationship, but definitely she has friends.
And does she take medication?
Yes.
Does she seem to be progressing well, or is it getting worse as she grows older?
Definitely, probably getting worse as she gets older.
Well, thank you for your time.